Special Advisor for Public Safety and Emergency Preparedness for all of Canada. He's Dr. James Young.
Thanks very much. Thank you very much, Moses. It's really a pleasure to be here. What I'd like to do today is talk about things that I've been thinking a lot about right now and frame them as a challenge to all of us. I'm not going to have all of the answers this afternoon. I don't want to be too pessimistic about what I'm going to talk about today. So I maintain that we're going to see a lot more large emergencies in the future. We certainly are seeing the effects of global warming. We're seeing situations now where we have 100-year floods, 500-year floods. We had a heat wave in Europe 3 summers ago that 16,000 people died in France alone. We all saw and experienced in Ontario the effect of aging infrastructure and interconnectivity when we had the power blackout. And the root cause of that was some branches on the power lines that weren't trimmed sufficiently, and a hydro utility that failed to operate within accepted principles. And what we learn in this highly interconnected world we're in is that we're only as good as our weakest link. We certainly are aware of the problems and the increased danger of terrorism, and I'm going to finish up with a few words in pandemics. So what we're seeing in emergencies are more frequent emergencies. I can promise you they're complex. They are international in scope, whether it's Sars. The Bali bombing resulted in deaths of people from 25 countries. People from 50 countries died in the 9/11 bombings. And of course, they have huge consequences. I'm going to very quickly talk about Sars because Sars is very important. It's a very good example. One of the key features of Sars was that it was going and running in the marketplace in Guangdong province for some months. And the Chinese government kept it secret from the rest of the world. Eventually, a doctor from Guangdong province went to a wedding at the Metropole Hotel, and he stayed, interestingly enough, in room 911 of the hotel. And he spread it to people from Vietnam, Hong Kong, Singapore, and Canada. And that's what started the worldwide epidemic. But one of the key lessons is persuading developing countries like China to be honest about the problems they're facing, to come clean with them, and the developing world to put the resources into those countries to manage the emerging diseases. And that was not done in SARS, and if it isn't done successfully in the future, what we face is a very large pandemic. Here's really what happened. Here's our couple at the top. Can't get this to work, but the two people at the top. The circle with the line through it is our 78-year-old lady who was in the Metropole Hotel, came home, got sick after she returned to Canada, was treated with antibiotics, subsequently died, and her son, who's on the second row, the square with the line through, went to the Grace Hospital on the 7th of March. He deteriorated and he died on the 13th of March. What happened then is, by the time that person died, SARS had already been transmitted to the two people on stretchers next to him in the emergency department, and they in turn had spread it to a whole lot of other people. So the problem that we faced in SARS is, and the problem we face now, is we can have a disease because of the modern global world spread into our society before we even know that such an illness exists in the world. Go on to the next one, we'll see. So we face prospects of dealing with agents that we don't know. We don't know the incubation period. We don't know the mode of transportation. We didn't have a diagnostic test. And so what we now have to build in today's world in the medical system is surveillance systems looking for illnesses that don't exist at this point in time. Because if we fail to do that and they get into the system before we know they're there, then we have to play catch up and we face the same sort of risks that we did during the SARS epidemic. Next slide, please. And the big one, and the one we worry about, the avian flu, represents the new Spanish flu, and there is considerable debate that the Spanish flu probably was an avian flu. Somewhere between 20 and 50 million people died of the avian flu in 1918, 1919. It took 2 years to spread around the world. We now think that if a flu started in a developing country and started to spread, it would probably take 2 months to spread around the world. Despite better medical care, our system would be so overwhelmed that in fact the medical healthcare system as we know it would only be able to marginally deal with this. And what we are seeing is evidence that the number of avian flu breakouts and the severity of them is growing. The new figures now are that about 75 people have caught the illness, 65 of those people have died. What we're really worried may happen is that the illness gets into humans or into a pig or some other animal at the same time as a human virus. It then mutates as a result of that and now becomes transmissible person to person and would have a mortality rate of anywhere from 5 to 10 to 15 to 20%. Depending on that, depends how many people die. And so what we're in a rush for is treatments and vaccines. And worldwide, we're looking for antiviral treatments, we're looking for vaccines, we're looking for the kind of science we saw this morning with Sars. So the challenge for us is that we must, as a global world, look at international cooperation, coordination, and integration. We have to be monitoring situations constantly. We have to be pouncing on them proactively as soon as they happen. And we must take a very aggressive approach when and if they do happen, as we did in SARS. Next slide. If we get through it all and we have masks and equipment left over, we'll use it for the West Nile virus. Thank you very much.